All right, Dad, I think you're looking good. Your knee's looking pretty good.
Yeah, I think everything went pretty good. The doctor said it went all smooth, so.
Are you feeling all right?
Yes. I mean, it hurts, but it's supposed
Well,
to.
that's
right?
pretty normal. Well, all right. Well, I've got to run kids around for a few days, so I won't be seeing you, but you just hang in there and I'll be back to see you as soon as I can, all right?
Okay.
Okay. See ya.
This knee's starting to hurt. I don't feel very good. It hurts a lot. Really starting to hurt. I'm gonna be sorry.
Hey, Dad. How you doing? Dad? What's going on?
What are you?
Dad, it's me. It's Betsy.
Who's Betsy?
Let's take a look. What in the flip? Where is your flippin' nurse? We gotta get you out of here. Dad, I'm gonna take good care of you. Just a minute.
Hi, RJ. I'm Leela. This is Devin. We're going to be your nurses
RJ.
today. How are you doing? Yeah? Not so good right now? So, it hurts? You came in last night from a skilled nursing facility? You've been there since you had your knee replacement? Yeah? So, RJ's a 72-year-old male. He was admitted last night from a rehab facility following a total knee replacement. The staff stated that he had altered mental status and he was not able to ambulate. And he was admitted to our unit early this morning. His history is hypertension, AFib, and type 2 diabetes. He has no known allergies, and he's currently taking metformin, lisinopril, amiodarone, warfarin, and is on 2 liters of oxygen. Okay, we're gonna go ahead and take some vitals. Is that all right? You can just lay there.
We're going to start you on some fluids here.
Can I check your pupils? I'm gonna shine a light in your eyes. Is that all right? Can I have your hands? My other hand, can you grip my hands? Can you pull? Can you push? Thank you.
Okay, we're going to listen to your heart and lungs real quick. We're going to set you up just a little, all right?
You okay?
I'm all right. Arjun, can you take a deep breath? You want to help me just sit him up a little?
Yeah. Can you sit up? Go ahead and lean your head back.
We're just going to listen to your, or check your pulse here for a little.
We are going to go ahead and take your blood pressure and your temperature. Is that all right?
You got a temperature of 34 degrees Celsius. I'm going to go ahead and listen to your bowel sounds, RJ. Check your pedal pulse.
So is your knee what's causing the biggest amount of pain you've got right now? Yeah, how long has it been hurting? You don't know? Looks pretty painful here. You've got some, looks like your wound isn't healing very well. We better have our, is that hurting when he touches the area, or am I hurting it? Do you know what your pain level is from 0 to 10? 0 being the least amount of pain and 10 being the most you've ever had? A 9? Okay, well let's call the doctor and see what we can do about that.
We get you some pain medication.
Alright, so we found that the patient's tachycardic heart rate's 150. He's got a low blood pressure of 84/50, and his respirations are 22. His O2 sats are 92%, and his temperature is at 94. We heard some crackles in the lungs, so these findings are kind of leaning towards a sepsis.
So for septic shock, labs that we would want to do to determine that is drawing a blood culture first for culture insensitivity. We would check a CBC with differential for the white blood counts and platelets. We would do a CMP for liver and kidney function. We would also do a lactic acid test, which would let us know the levels of stress in the body, and an ABG to monitor the oxygen and CO2 levels. Finally, we would do a CR.
Hi there, Betsy. How are you today?
Doing all right. How are you?
Good. So the doctor's just given me permission to kind of go through RJ's diagnosis with you. So he's been diagnosed with septic shock due to the infection in the surgical site here on his knee. We started him on a broad-spectrum antibiotic. And that's just going to treat the infection in his blood and try to get that cleared up. We have also given him some pain medication to help with that. I know he was having some pain. Got that going for him. From there, we're just going to kind of keep continuing to monitor his blood work to make sure those antibiotics are effective and they're actually bringing the infection levels down.
Okay. So what is this that was going on with him? Sorry, you probably told me, but my brain's just...
Yeah, so the infection in his knee just spread throughout the rest of his body. So it's kind of just in his blood.
So is that what was causing him to be like confused, and like I found him and he didn't even know where I was.
Right,
and
yeah. Confusion is a common symptom of sepsis, septic shock. So,
All right. Thank you for your help.
no problem.